Hello friends, welcome to Creative Medicine. In this lecture, we will learn about 60-year-old man was brought to the psychiatrist with a 10-year history that he suspects his neighbors and he feels that whenever he passes by, they sneeze and plan against him behind his back. He feels that his wife has been replaced by a double. Okay, and he calls the police for help. He is well groomed, occasionally consumes alcohol. Likely diagnosis is okay. Let us break the thing. So 10-year history. So he is brought with 10-year history. So the duration is for 10 years. That there is planning or conspiracy by the neighbors. So this is delusion of persecution. Okay, then he feels that the wife has been replaced by a doubles. So wife being replaced by double is a Capgras syndrome, and thus he starts fighting with his wife. Okay, next. So here the patient has Capgras syndrome, delusion of persecution, and also occasional alcoholic. So because it is not related to alcohol withdrawal, conversion syndrome is wrong. Okay, here this is actually a paranoid schizophrenia because there is two delusions. There is delusion of persecution with delusion with Capgras syndrome is seen. Okay, and here in the question there is patient is well groomed. This word well groomed will tell us that the personality of the patient is actually preserved because he is well groomed. So in paranoid schizophrenia, personality is preserved in paranoid schizophrenia. So this is a picture of paranoid schizophrenia. Thank you, and thank you for watching.